calling me, asking me what was our phased back-in approach. So with haste, I took what we had done to go out, and then with the guidelines from the federal government, started asking questions of myself what it might look like. I realized that a lot of this might actually change based on the information. If you are in Texas, I know we're a little bit bigger than Texas, but when Governor Abbott rolls out things, it might change. As it's been interesting for me to be in conversations where there's a whole lot of shaming going on for people's views about either being present for worship or not being present for worship. I think that is a terrible posture, and I hope if all clergy can say, let's just relax a little bit. Some of us serve counties that had 0 coronavirus cases, and so naturally there's anxiety there about getting back to the business of things. And then some of us serve in large areas and have lots and lots of cases where it's just not responsible to begin to meet again. And so we have to stand in that gap. So that's my intro to this, to say this is information for me to help stand in that gap with my congregation and put back on some of the leaders to help answer some of the questions. Instead of me saying, here's what we're doing, this is a document that helps everyone begin to ask questions about what's responsible in our own series, in our own settings. So in phase 1, you can see that the first column, column B, is the gating criteria that the federal government laid out. Now, once Governor Abbott makes his, I think there's supposed to be a big conference today, then I may actually add a column for state guidelines as well. But what I've done in the first column all the way down is just say, here is what the federal government has said if phase 1 to go back to business looks like, which for some of us doesn't look any different than what we have already been doing.
Suzanne, let me stop. Just briefly tell us what gating criteria means, because
that's what the federal government is calling it. So gating criteria, if you go down, that's what the gating criteria is. So gating criteria mean, and if you go across, there's a downward trajectory in COVID cases in your community or state or county, however you want to say that. There's no crisis care in hospitals. So that means when I went to the CDC website, crisis care means that you've got enough ventilators, you've got enough nursing staff, you're not using field hospitals, et cetera, et cetera. That's what crisis care meant for them. That robust testing, if you're going across on line 2 all this way, robust tests have been established, and I'm assuming that means for people to do drive-up testing or whatever. So that's, if you look at the first row, it would be row number 2. Gating criteria have been met means all of those things. Okay, that's what the federal government is saying. Yeah. And then if you go down, right, we're having to all use our axis and all those good things, the Y and the X. You go down, then what I've done is taken that and put it towards what it means for different aspects of church life, which would be worship, small groups, children, youth, maybe office staff. So knowing that the government is saying 10 or less in a space only when there's a downward trajectory, there's no crisis care in hospitals, robust testing has been established, et cetera. You see how this works. Then that's what that means down that column. So then...
Yeah, and I think, Suzanne, I would just want to say, check my perceptions here, but it seems to me that one of the things that you've done that I think would have to be instructive to all of us is identified all of the groups who access your facility and have understand the implications for every segment, not just once worship begins, everything goes back to normal.
Correct.
But a real intentional assessment or a cataloging of who uses your building.
That's right. And this is only for the parish. So this is for my particular setting.
Right.
We don't have a shower ministry, for example. So if you have that, you would need to add your own and think about that. So if you look at, so B are the things based on gating criteria, what we could or could not do that the government is telling us. But in column C are questions to address. So for each of those elements, these are the questions that I'm giving back to our leadership. So this isn't just me deciding, this is me having conversation, which I think has been the healthiest thing for me. So that it's not Suzanne is saying, but we are deciding. So in very disciple fashion, right? So in worship, for example, you will see, do we need to go to live worship in an empty sanctuary? Some of you are already doing that. So please remember, this is for my particular context. If there's no more than 10 people in public gatherings and you must maintain physical distancing of 6 feet, right? Do we need to go back to live worship in an empty sanctuary with just staff? How does this impact volunteers if we do that? A lot of us are small churches. We rely on our volunteers to make worship happen. We don't have staff. So how does this impact for me? If they asked me to come in and do this, do I preach with the mask? Because I'm coming from a metropolitan area into a rural area. What does that look like on camera? How does that raise anxiety levels, et cetera, et cetera? So, and we don't need to walk through this whole document because you guys are adults and you can do that. But what I'm trying to show you is on each of the phases, there are questions to address that I've outlined for my own community. I'm sure that you will come up with your own questions in your own place and what that means. And so then in column D and E, et cetera, we've outlined what the cleaning practices look like if we do this, what does staffing need to look like, what precautions are we taking, what might even financial implications be if we continue in this phase. And so that's what this looks like. You can see phase 1 is the most extensive. When you go to phase 2, based on the government, will you go to that next page? Yeah, purple. Phase 2 means there's no evidence of rebound. Okay, so that's what that is up top. That's what the federal government is saying. And then with no evidence of rebound, what they're saying is that all vulnerable individuals should continue shelter in place. Gatherings of less than 50 can be allowed only if you can physically distance. So that would mean a 6-foot radius around people or closed family groups. So when you look at that, for example, in worship, what does that mean? Does that mean we're doing temperature checks for people coming in and out of worship? How do we determine seating? What if you have more than 50 people who come to worship? Then what do you do? Like, is it a first come, first serve? How do you do that? For us, we're thinking about our enrollment, which should have already started for MDO. We don't even know if we're going to be in a place where we can have daycare in September. So you can see how we're beginning to kind of think through what these different phases mean for church life. I think for my congregation, they're just ready. And maybe you've got people that are pressuring you to say, we're just ready. We're just ready to come back. We know what it means. We'll wear gloves, we'll wear masks. But when you outline things like this, I think it takes some of the anxiety down and the pressure down to say, oh, we didn't realize, right, we have more than 50 to come to church. What can we do about that? Or, and again, I will just say, I like to push is such a negative word, but whatever. I like to push things back on my leadership because it allows them to really think through things and then they can be the advocate for what we're doing. So it's not just coming from me. Andy, real quick, will you go to the last slide? So this phase 3 for the government means that you're continuing to meet the gating criteria, which means there's no second rebound. Okay. This is where you're hearing some of the things about sporting events can't happen until we're in this phase with public, et cetera. Like sporting events can happen in phase 2, but not in phase 1. And then in phase 3, it's possible, only possible, that public gets to come back. So what does that mean for worship? It's things like vulnerable people can start coming back and being with you, but you have to make accommodations for them, just like you would for any other special needs population group. So what does that mean? And the government is also saying that people that do gatherings of this, they need to be encouraging their people to not spend a lot of time together in a social situation in a confined space. So what does that look like for worship? For those of you that have a lot of people that come to worship and we like to hug and kiss and do all the good things that church people do, but should we be theologically and ethically asking people to do that when we've got a lot of special needs people in our congregation? And then for me, one of the biggest questions we're tackling is, what are we going to do for people who decide not to engage in worship again for whatever reason that might be? They're out of pattern, they are nervous, they're anxious, they're vulnerable. That's a question we want to address. And then also my congregation is talking about how will we continue to use technology to continue to reach people for worship? Because we have heard feedback, maybe you have too, that a lot of our people like the option of worshiping in their pajamas and their bunny slippers. And so if that's the case, do we continue to meet that need because that's something that people desire, or do we say, no, you need to be back in your space? or is it something in between? So, because I know a lot of us had to ramp up technology pretty quickly for this. It wasn't, native to us. So what does that look like? And it may look like buying new technology, having more licensing options than we were comfortable with, maybe having a technology person come on site and help us do all of this, at least get it set up and trained. So there's a lot that goes into that. Okay, I'm going to be quiet. That was a whole lot. Are there questions about this?
Suzanne, this is really helpful. And I appreciate that it's adaptable. Jacksboro is very different from where Deb and I are,
right,
in terms of number of cases, and we have church members who are providing care for COVID patients right now.
Right.
So thank you so much for this. This is helpful. Some of the things that we've done already, but putting it in this way is really helpful. And amen. It's a group decision, not a hierarchical decision. Right. I've decided this is what we're doing.
Right.
Right.
So thank you.
And for me, it was hierarchical at the beginning. I mean, I felt like I had to make the decision, but I really love your process for having the church body take ownership and the leaders take ownership, and to put it in such a organized fashion based upon what our government, our states, our cities even are telling us to do. So this is why I came on today. I'm being pushed. And so I was wondering what everybody else was thinking. And so this is perfect. Thanks.
Well, good. I think most of our people, I shouldn't say that. A lot of our church people are linear thinkers, at least in my context, they are. So they needed a linear document. Like I can hold all the theological and ethical, what we should and shouldn't do, and what feels good and what I can hold all that because I'm a unicorn when it comes to things like that. But my leaders are very linear. So they needed a linear document, and it helps us, I think, address the needs. I come from Fort Worth and drive 71 miles to serve my church. My partner, Brian, is right now in China. He flies for FedEx. He's been basically in and out of China since February the 14th. It is irresponsible for me to even go and film in my sanctuary with other people, because while we have been tested, we have to be tested, et cetera, for him to be able to do his job. We're fine. I just don't still know what I'm carrying in, right? And my congregation had a really hard time accepting that, which is why we kind of went to these kind of documents, so to help them process.
Yeah. Suzanne, I want to ask several questions, but also make a editorial remark. One, thank you. I think I speak for everybody on this call. This is really, really helpful. So part of my question, though, getting back to your chart, and I realize that part of the answer is going to be that people can modify this based on their own needs, and this is just a starting point. But I did notice that personal behaviors didn't have their own column. They were included in different points. So did y'all do that intentionally, or is that just how you're thinking and the work that you did?
Well, really, I modeled this on the first documents I did, which were how to phase out. And so we had personal behaviors listed in each category rather than as a separate thing. And so since my particular leadership had those first sets of documents, and they were color coded, we were matching things to that, which in retrospect, I should have had a column for personal responsibility. And I love what you just said about, kind of even the 3 levels there. And that would be something I would advocate that people add, is what does personal responsibility look like in your own setting? So it's different in Midland than it is in Jacksboro, than it is Houston. Right. And so I think that would be super important to add to that.
Thanks. That's helpful. Peggy, I need you to sustain the conversation for just a second, because I got to figure out how to turn to plug my computer in.
I had a question/comment too. I've been fielding some conversations with clergy who fall into that category of either being uncomfortable of returning back or not being able by the guidelines to return back. And so I think how we enable congregations and other clergy and how the region supports those clergy is going to be important now, because there's going to be people who fall into a vulnerable category who, what is their church door? What do they do? How do they manage that in this time frame? And then I would also, I know a lot of us, I'm trying to look, are from bigger cities. Like we sit on the border of three counties. Like we're in Harris County, but you go like 100 feet west and you're in Waller County, and you go 6 miles south and you're in Fort Bend County, who all have radically different rules right now. And so one thing we talked about, as we've been talking about and making our own plan like this, is the least common denominator. We feel like we have to plan for, and it's been really helpful to say that, we have to plan for whatever the least common is. So Harris County is the strictest. That's what we're going to plan for. Or the person who's going to be most uncomfortable and isn't going to speak up in our congregation. Mm-hmm. That's who we're planning for. And as soon as we had that language, made it a lot easier for some of the leadership to get on board and kind of let go of their need or want or desire.
Heather, I think that's really smart, because some of the pushback I got was, I was saying early on, I'm coming with a team, and you are asking me to come into a place that doesn't have cases. That is irresponsible of me as a leader. And when I started using the language of responsibility as a leader, they were able to hear that differently. And I kept saying, I want to see you. Let's set up dinner with the pastor. Like we do all these Zoom dinners with me, and I'm eating at my table and they're eating whatever they're eating, and let's do things, but I don't want to get you sick. And I use language to say, what happens? What responsibility does the church have if we or one of our leaders gets someone sick? What does that look like for us in a grief process, in an insurance, mindset, in an ethical responsibility mindset? And because they're just not thinking in those terms. And while I feel like that's a little harsh, it was really important for me to just be straightforward and honest and say, I like what you're saying. So for me, what I've said is, Jacksboro has to go by what Fort Worth is doing, because that's where I am. And a lot of our people drive to Fort Worth to go to Costco. So if that's the case, then we have to do what Tarrant County is doing, right? Not what necessarily Jack County is doing. So I think for you, it's the same way, and Midland and Odessa might be, similar too, and things like that. So
I think another reality that we were talking about yesterday as regional staff is that if we're very honest with ourselves, so many of our congregations are predominantly people who are over 65. And when that's the norm, then that should affect and make it pretty easy to make a lot of decisions about what to do. I've been thinking about how the first ones who are able to come back and to resume the life of the church are going to be the younger, healthier ones. And that's going to be very difficult for some congregations if their primary leaders have been the elders who've been in charge for a long time. It'll be very interesting, don't you think, sociologically, to look at the shift in who is proactive, who steps up with maturity, both emotionally, spiritually, in every way, to be the leaders on the ground when we resume our face-to-face life of community together again.
And that I would just say, who am I? But I would just say, everybody, I think what Peggy just said is very prophetic. And we would do well to set aside whatever series we were working on beforehand and maybe pull some texts around that and help our people get language around that in our worship settings. Our youth group, which if you don't know about Jacksboro Parish, we're part Presbyterian, part Disciples. And our youth group is also Methodist, because they don't have enough money. So that's our youth group are those. And we have about 40, in our youth group. And so they called me last week and said, the youth minister said, Suzanne's been working way too hard. It's our turn. We're going to move Youth Sunday, which was supposed to be at the end of May. We're going to move Youth Sunday. We want to move Youth Sunday, and we want to do worship for a week. To which I was like, hallelujah. So maybe now is the time to give opportunities that let's just hear my gentleness, which I'm not a gentle person, but hear my gentleness when I say, release some control, pastors. Okay, release some control and say, and maybe ask your young adults if you've got them, or your youth, and say, you know, we could really use your gifts right now. You know, they're digital natives. Why aren't we asking our digital natives to help us in this? You know, our youth really stepped up this week. I'm so excited to see what they do and to keep calling on them in this time as models and helpful. They've been running a Zoom class for our seniors on how to interact with our YouTube page, and just asking them to take some leadership like that also, I think, takes down the anxiety from some of our other people on how we're going to keep doing church, because people, I think, are always more permissive to youth, to allow them to do things. And so now I think would be the time to really focus on that if you have youth in your congregation. So.
And do some of the rest of you have questions that you'd like to raise with Suzanne? Suzanne, you're brilliant. We appreciate you taking the time to be with us. And I don't know how much more time you have to be with us, but you all ask your questions and have conversation as you wish.
I'm here for 15 more minutes before I have a general church call. I'm sorry. So, but so I'll just hop off when I need to, because I'm excited to hear about preaching and what people are doing.
So I have a question, and we've talked about the vulnerable communities, the 65 plus, and I have to say I've been so proud of most of my seniors who are definitely not this natives to this world, but a great majority of them have learned and are participating, even if it is just using their cell phone to get onto our Zoom worship. But what the folks who don't have computers with the cameras and the microphones, who are just either on their telephones listening or or don't even understand how to do that. They are the ones who are being excluded right now from church life in all aspects, but especially worship. And so I'm wondering, has anybody, I think we can only do this when we can start getting back a little out in the world, but I feel like we need to get technology and training to that group of people. And Vanessa, I don't know what you have done at Fowler or what they're doing, but that would be really interesting to hear.
Yeah, I'll be glad to share. And luckily I'm balancing two very unique situations that are completely opposite. So at Fowler, we actually have our closed circuit TV in the sanctuary. So we're able, I'm actually doing the service on Sunday afternoons, and it goes into the residents' apartments. And so they are participating that way. It's very much like a Facebook Live service, but it's just on the TV, on their closed circuit TV. We do all the normal rituals. We have communion. We have, you know, it's very similar to what they were all used to anyway. They're just hearing me every week instead of the different churches. And when we phase back in, I'm hoping, I really appreciate this, Suzanne, because I'm hoping to phase back in with, you know, maybe bringing the churches in or a couple of people from the churches to do what I'm doing right now, instead of, I mean, even before the residents are allowed back together to be together. And then I'm also leading, since December, I've been pastoring the church in Richland Springs, Texas, in Brownwood County. So Dallas County, Brownwood County, very different, but we've been doing a Facebook Live service there. And a lot of that is for the same reasons that you were just mentioning, Deborah. There's no technology for some of them. So having a Zoom interactive service isn't realistic for them. However, I mean, there's good points to it as well. There's people that are participating that are members of the church that haven't been able to worship in a long time because they live somewhere else, but they still support the church. So attendance and even giving and everything is up, but it's just different people. So it's almost like a whole new church differently. So that's kind of where I'm at. And you know, all of these just information is so helpful as we figure out what we're going to do next. So.
Yeah. Dottie was trying to jump in a little earlier. Thank you, Vanessa. I appreciate your comments there. That's helpful.
No, that's just really, I think what Peggy said has a lot, you know, seeing what will evolve leadership wise. I do have a concern though that it will be, my congregation, they may be 65 and older and they might go grocery shopping to take advantage of it, but it doesn't mean they're going to stay home when church comes back unless I bar the door, because they're going to say, I can come out, I don't give a flip. One of my most vulnerable ones, I lived through polio, I can live through this, I don't care. But we have a lot of medical staff who are our younger leadership, and they are not coming back because they say, just like you, Suzanne, I don't know what I'm carrying. And many of our younger leaders are saying, you know, I'm scared about what I'm bringing from work. We have one who's working in a COVID unit right now, and two others who are chaplains, and they're going, you know, we love, and then one who is so worn out with Zoom meetings that with work, there's a level of exhaustion with those that we're talking about stepping up. They are so exhausted by spending all day doing this and doing what Heather's doing, you know, working all day and homeschooling. And I've done some projects with Heather's family. She hadn't known it, but I've done that. And I did estimation jars with the Bruce family in Kentucky the other day. But I mean, it's just, I can't believe the kind of stress that is on that folk with young families. And I don't know how that, I'm concerned about where the emotional toll, because they'll still be working some from Zoom. That's going to be a norm.
And Dottie, I think that your comment and Suzanne's concern that she mentioned just a few minutes ago go hand in hand, in that it may be time for us to set aside some of the series or plans that we had for worship and to really take care of meeting people where they are, pastorally, theologically, spiritually, pragmatically in life, to do pastoral ministry and worship hand in hand.
Absolutely. Absolutely. Thank you. Yes.